Okay, so hi, good evening, everyone. I hope I am audible, visible to all of you. Okay, so how is the audio and video? Am I audible? Am I visible to all of you? Audible? Am I visible to all of you? So if some of you can please confirm the audio and video. So, hi, good evening, Satyam. I hope the audio and video are fine. Yeah, great. So, guys, I am Dr. Sushil, your orthopedic faculty at DBMCI, and today's session is not at all about academics. It is a session about the messages that the students who have been like sending messages for last some 5 6 days since this result came, the All India result came. Okay, so the successful candidates, again, once again, I would like to congratulate all of them that you all have done a tremendously fantastic work, and all the labor, all the efforts, all the the time that you have devoted for yourself, that has now actually paid to you. So now, what about those students who have not been able to perform well, those who are not like satisfied with their ranks, with the scorecard basically, and probably they would like to go ahead with the INI exam, maybe the next NEET or the next exam that we are going to have. Okay, so point is like what is the road ahead? Many people, like I have got multiple messages, multiple stata, multiple kind of students who have sent the message. Like I'll quote some example. Okay, number one is a student who is in a medical job, who is in a basically government job. Okay, and he has been like into the probation period. You know that whenever somebody cracks the combined medical services examination, then there he has to serve some probation period, which is usually of 2 years, and then he gets into the permanent part of the system, central government job. So a student who has been in a probation period has got a like given this exam, got a rank, and now he's in dilemma whether he should go ahead or no, because if he goes ahead, his job will be lost, and if he doesn't go ahead, he doesn't really have an idea that how next year he's going to perform. Another one whose attempt was the first attempt, and he has the student has not been able to really read well, so it was kind of testing platform this time, and he wants to go ahead with the obviously next exam. Some of the students who have given the exam for the second time now, the first time was a practice session, and this time they were like well prepared, but still somehow some strategies went wrong. So guys, I'll just do one thing. If you have something you want to discuss with me, you can put in the chat box, the inbox that we are having right now. And till then, what I'll do is I'll just read out all the messages that I've got on my Telegram with me or my WhatsApp with me, and I'll take just one example of each one of them, and I'll try to tell you like what my plan is, what my strategy is, or what my advice is to you to go ahead with the INI, upcoming INI exam, the announcement for which already has been made, or maybe the next exam that we are going to have in most likely December month of this year, the NEET or the next. Okay, so starting from the very first one. So I'm just reading out the message as such. I'll not name the student, obviously, and yeah. So first message I have is, see, hello sir, I wish to take ortho in the NEET PG, but due to some silly mistakes, I ended with 490 marks and broadly close to 22,000 rank. Now getting tensed. What should I go ahead? Sorry. So should I go ahead with like some other branch? Should I try again? And do I have any chance? Like this was my first attempt. So everybody who has got the first attempt, I would like to say that if you are not getting a seat of your choice, right, whether it's a degree or whether it's a DNB, you're not getting a seat of your choice and you have to compromise on it, then my straightforward statement to everybody is that please give yourself another chance. Because see, this degree is going to be something which is going to be with you for your whole life, and even after you will be recognized by that degree only. Okay, so this, if a subject, if a particular specialty has been your dream, is something which you can't actually live without with, so you have to prepare again and you have to go again. If you're adamant that I want to be orthopedician, I want to be a radiologist, I want to be a physician, I want to be a like gynecologist, like that, so whatever you have felt for yourself, whatever you have decided for yourself, my single statement is please go ahead with it, please go ahead with the preparation again, and just try to get what you want for yourself, right? There are few things in life which you can never change. Okay, once you are done, once you enter into a system after 10 years from now, it will be like almost impractical thing to plan again, and you will have the regret for the rest of your life. So this is something, if you have a chance, if you want to go ahead like with your own dream branch, please prepare again and please go for it. If you have scored around like 22,000 rank, I don't think it's a very bad rank. It's a pretty good one for the very first timer if your subjects were not good. So I would just recommend that please give yourself another chance, and for sure if you get it, you will be at least satisfied for the rest of life that you tried it, you attempted it. What worst can happen? This 22,000 will remain 22,000 if you stay on track, right? What is the worst scenario that can happen is you are not going to improvise. That's okay, fine. What you are getting today, you are going to get next time also, isn't it? So just stay on the track, stay focused, stay adamant, and just go for it. So prepare again. That is my statement to you. Now another one, I'll take few of the messages of Telegram first, and then I'll come out to your chat box. Okay. Second one is that sir, if I do another one, if I do TND nicely, do I need to go and read the notes again? Because combining these two, it takes a lot of time. I got broadly 576 marks. How do I say set myself right for the INI or maybe for the NEET exam? Now see, understand this, 576 score if you have got, okay, and if you're preparing for the INI, if you're somewhere close to like 550 score, 550 to 600 score, then obviously you have some good chance to go ahead with the INI plan. There is no trouble with the for that. So those students who are stuck somewhere like this between the NEET exam, a good kind of score, and going for the INI, so the strategy has to be whatever you have been reading till now has been accurate actually, and that is the reason why you have got a score close to 600, right? So it's fine, let's go ahead with that. And along with that, now you have to improvise yourself, you have to find your mistakes, and that can be done by the test and discussions or the test series basically. So wherever you are, whatever you might be using, so for INI again, go ahead with the test and discussion plans, attempt a test, go for the discussion, just assess yourself, where do you stand today, how many questions have been wrong, and what is the reason why that question has been wrong. Was that a like conceptual question, was that a factual question? Identify it and work on it. If it is a like factual question, we try to make some mnemonic, we try to make some sketches, maybe some diagrams, and we try to remember them on the way we can. It is different for different student. If it is a conceptual thing, whatever platform you might be using, if you're a part of DBMCA, obviously I would say that tag our faculties in the DBMCA Premier group, and if the concept will be explained again by the means of some video, by the means of some explanations, maybe by the means of images, and that will be the way in which you can improvise yourself. Okay, staying on the track, staying on the track, be little adamant on what you want is only thing what you require right now. Okay, the discipline, if you can maintain your discipline at this point of time, the INI for you guys will not be a difficult thing. Okay, if you observe the questionnaires of the INI exam, they have not been very troubling. They have been simple clinical basic questions which every MBBS graduate is supposed to know. Like 1 or 2% questionnaires will be new every time, right? Whatever new they are getting in their OPDs, they might be adding as their MCQs. That's fine. Our fight is not for that one particular question. Our fight is for the rest of the basic paper, which is same for everybody else. Okay, so you need to stick to the basics. That is the most important thing you have to understand. right? So this is for the ones who have got some good kind of decent kind of score and want to go for INI exam. Okay, next one I have, I didn't get my rank as expected. There is a 50-50% chance of getting a seat. I want to prepare for the upcoming INI. Now, see, a student who has got a decent kind of score is going to prepare for INI. The road is a little easier for us. Another student who is messaging that I have got a 50-50 chance of getting any kind of seat in NEET exam and I want to prepare for INI. Now, this is what you need to have right now, the confidence that what if I was not able to do the NEET, good this time. That's all right. That's perfectly fine because see, every day is a new day, right? And that probably that day was not your good one, and so therefore you have not been able to perform well. That's absolutely okay. Doesn't really matter. Go ahead with the discipline, with the plan, with the schedule, and believe me, schedule is the most important thing. If you have your schedule with you and if you are completing that schedule time bound manner, then it is going to be like very useful for you, right? So yes, you can very well go ahead with that. For the schedule, it's very simple. Either you take a schedule of the institute, like we have launched already the INI TND batch. So for that, you can take the schedule from us, like how we are going to complete the batches, how we are going to show you the test series, how we are going to give you the discussion part, the test paper and all, and you can go according to our schedule only. So the basic idea is, if you are able to make a schedule for yourself, fantastic. If you can't make a schedule for yourself, take it from us, right? The schedule part. Okay, so that would be very easier for us. Now, the next one was, yeah, that's a very big message. He says, hi sir, myself so and so. I'm writing this message with lot of confusion and lot of burden and heaviness in my heart. I got 1 lakh rank in the NEET PG 2023. This is my third attempt. Okay, for my first attempt there was COVID, so I got like I was not able to work, study at that time, and I was in my job, so I had to support my family. During my second attempt, I was not doing a sincere attempt, so I didn't got it. But I have no reason to tell you that why I did not perform well in the second attempt, because I was not really reading well. Now this is my third attempt. I actually read. I did few subjects from this particular platform. I did few subjects from Bhatia. Okay, so now I joined revision program in Bhatia during last 2 months only. I gave some cumulative tests, GTs, got a score of around 100 or 110 in those tests for my rank. Based on last year counseling, I might get like micro, pharma, anatomy, biochem, physio. Like my parents are very supportive, but they want me to give another attempt. Okay, so now there is a long message that I need to support my family. My father is in big financial trouble to pay me for anything like that. So basically, see, understand the problem, the dilemma here is that 2 attempts, now this is the third attempt, and now the people are scoring not a very decent rank. It's a very I can bluntly say it's not a like good one or a very poor rank. I can simply say that. Okay, so now the point is, what should I do? What is the biggest mistake you think anybody is doing? See, the biggest mistake anybody does is to read the same subject, same content from multiple platforms. I can say this very openly here. See, what happens is, when you are reading a class, let's say subject A from our faculties from Bhatia, okay, you take orthopedics from me, and then you see your friend's notebook also, and then another friend's notebook also, and you start comparing it. See, everybody teaching out there is good. Okay, nobody is teaching you to make some loss to you. So trust on whatever academic content you have. Trust on that. Okay, you have to trust on that. If you just keep on running here and there for multiple platforms and multiple content, it is not going to be very fruitful. I have a very another recent example with me. A girl, a very brilliant girl from one of the centers we have, and now last year she qualified the exam. She got one of the seat. She dropped it because she wanted general surgery only, and this year she has got another rank of 10,000. Now again, when she called me and she talked to me, another same problem was there also, because she was following multiple platforms for everything, for the subject content, for the test platform, for everything. See, giving tests from different platforms is never a bad idea. It's good if you can like keep yourself on track. If you can complete your subject in a time bound manner, it is going to be very fruitful for you, right? That's going to be very fantastic for you. But the point is, if you can't keep yourself on the track with multiple platform, if you give like orthopedics, if you give like 10 days to orthopedics, doesn't make a sense to me. because you were reading 2 days my orthopedic part, then your colleague's notebook, then another colleague's notebook. You have spent 6 days in just reading it, right? Just to compare that how much good or bad your content is. See, every content is good. You have to follow, you have to trust the platform you are onto. Okay, so give the test from two places if you are comfortable with it. Otherwise, give a test of the platform from which you have studied, because you already know that what all content you have mentioned in your notebook and where all you are lacking, the factual part, conceptual part, lacking of the q bank. That is not at all a good idea to go ahead with multiple things. That is like my suggestion. So guys, those who are watching me live right now, I'll not be repeating the points which I've just said, because I'm taking all the different kind of messages from different student. So for you, my friend, who has not been able to score well, just because it was your third attempt, don't loosen your heart. You can still do it. You can still make it. It's never a end of the story until you stop trying. So keep trying and you are going to achieve it. That is for sure. Okay. Stay on track. Stay with one platform, whatever you wish to. If you are with Dr. Bhatia's, like, stay with us, and I can assure you that we will keep you on the track. We'll force you to be on the track, and definitely the things will be fine for you. So this was for you, for your 1 lakh rank, or anybody who has not been able to do well. Okay. Now the next one I have is, yeah. Okay. Sir, hello sir. I got like 51,000 rank this year, close to 51,000. Thinking of another attempt. How should I proceed? So again, the same thing, guys. Those who have given this exam, the recent exam, NEET exam, for the very first attempt, okay, there is quite a possibility that you have not been very well versed with all the 19 subject. That is quite one possibility. Second part is, you have read all the 19 subject, but you have not been able to revise them well. That is another possibility. Third possibility is that you have read all the 19 subject, you have been through all the tests and discussions, but the point is you have not been able to retain it. That means there is something lacking with our preparation. So those who have given this exam for the very first time and have got not a very good rank, decent rank again, so I would say that first of all, be a part of some test and discussion platform. In the test and discussion platform, you need to stick to the schedule, stay on the track, and follow the subjects which are being taught. For example, if the coming Saturday or the coming Sunday you have test of orthopedics, for this week just dedicate it to orthopedics. The orthopedic notes you have, the orthopedic q bank you have, go to the test day, give the test, see the discussions, and then on the end of the day, within just one day, make sure that whatever mistakes you did in that particular test, you have been able to cover them up, you have been able to mark them up, you have been able to revise that particular topic from the subject, and the subject is supposed to be complete. Now, one thing with the test and discussion, one thing that happens usually is that I just keep on giving the test and discussion, test and discussion, test and discussion. See, the important point here is, it's very important part. Yeah, a very important part is, when you're giving the, or you're joining the test and discussion batch, anywhere. So one thing is very important to understand, that once you're giving the test, analyze the test. That's okay, that's fantastic if you're doing it. But the point is, after giving the third test and discussion paper, after giving 4 subjects, after giving 5 subjects, how do you keep yourself on the track? How do you think you should keep yourself on the track? So all the students who are giving the test and discussion, who are joining the test and discussion, I would recommend each one of you that you must be a part of some grand test series. Now understand what is the idea behind the grand test series. Whenever you are reading a subject, okay, and after that you are giving the q bank, the q bank is like this much, isn't it? When you give the SWT of that subject, this SWT becomes this much. And now when you are giving the GT, in the GT paper, you will have some 10, 15, 20 question of that particular subject. So out of this q bank, this much of q bank, you had this SWT, and now you are having this GT. So basically GT keeps you, sticked, or keeps you aware, keep you making revise those most important 10 to 20 question of that particular subject every time you give the GT. So it is always a good idea to give a GT again and again. Maybe preferably I would recommend that like once a month, or maybe if you're comfortable, twice a month. Now, when some people are giving the GTs, what is the first question they ask? Sir, in the GT, I have just done my 3 subjects. Okay, 3 subjects are completed, and now after 3 subjects, 4th I have given the paper as GT. But my question is, sir, that I have only done 3 subjects. My score is very low in GT. So understand this point, everyone, that GT, the first GT that you give, we are not giving it for the scoring system. We are not giving it for the ranking system, all India based. No, You are giving it as a student to make sure that all the three subjects that you have revised in recent past, you remain connected to the most important 10 or 20 question of those subjects. You just remain connected to it. Every time whenever you are giving the GT, it will happen that the most important questions of that subject will be there in that GT, isn't it? Orthopedics, you'll find one question on GCT for sure in TND, because last 5 years I can say the question has been there in the exam on TND, this GCT only. Right. So now if you're not able to revise all the other tumors, at least you are connected to GCT, you are connected to ABC, you are connected to osteosarcoma, you are connected to Ewing sarcoma. That is the purpose of giving a GT. So when you give the GT, make sure that all the three subjects that you have completed, out of those subjects, all your questions in the GT should be correct, right? If any of the question in the GT from those three subjects that you have completed, they are not right, that means our preparation for that particular topic is not good, and I'll revise my topic again, and I'll go back to the GT, next GT again. I'll just review, are my three subjects all right now or no? By the time you give another GT, you will have some completion of 4 subject, 5 subject, 6 subject. Now all the 6 subjects should be good in your recently conducted GT. That is the idea behind joining any test and discussion batch. That is a way to review yourself for any test and discussion and the grand test batch. Okay, that is like my recommendation to all of you. Right, let me read out another one. Okay, this one. Yeah, another one. See, another one is about, sir, myself so and so from DBMCI, this batch, this branch, I got like 3400 rank, close to, in the recently conducted NEET PG. I'm really not happy with this rank, and I want to do only radiology. But even in INI-CET, only top 100 to 200 rank gets radio. What do you think? Should I attempt INI or no? See, a student who is close to like 3400 rank, he's asking me that he wants to just join radiology. Nothing else is on his mind, right? So if you have a plan for yourself, as I said earlier, if you have a plan for yourself, then definitely you should go ahead with it. What is a harm in giving INI? Who is stopping you, right? So always remember, guys, I always tell all my students, the biggest, threat to you, the biggest, enemy of you is within you. If you can control and calm your nerves, if you can control and calm your mind, then you can win every single war of this world, right? So you are the one who is stopping yourself. Explore the possibilities. Who is stopping you from asking, the big thing for yourself? You are the men, who has to work for yourself. Nobody else is going to work for you. As a faculty, as an institute, I can just prepare the content for you. I can teach you the best of the content. I can give you the best of the Q bank. I can give you the best of the possibilities that what question can be asked in the exam. Sorry. But you are the one who need to prepare, right? So you are the one who has got like unexplorable things inside you. Just explore them. Just go for it. Whatever you want, just go for it. Okay. And nobody should be able to stop you. Give 100% to what you are doing. I really don't have any hope regarding INI-CET, because I have given my 100% in NEET, but luck did not favor me. Now what you are saying, that you have done 100%, let's say agreed. Sorry. So you have done your 100% in the NEET, but the luck didn't favor you. Maybe luck has something better for you. Okay, so don't blame anything on the luck, and I would recommend that each one of you should go for whatever you have planned for yourself. Okay, now okay, now next one is somebody is very happy on getting like rank of close to 3200, and they are very thankful for all the motivation, guidance and everything, mentor, orthopedics, everything. So congratulations again to all of them. See, I'll tell you something. All the students who have not been able to secure something very good, I have this student with me who secured a rank last year. I'm telling you, rank of 1,14,000 last year, and this time the rank secured is 1771. Now see how much has been the time difference between the two exams. Not much, less than a year. And in less than a year, he has done an improvisation of 1 lakh and 1,000 basically ranks. He has improved. He has come on to 1700 only, right? So 1,14,000 to just 1 lakh, this 1771 is the rank this time. Okay, so you too can do it. If anybody else can do it, you can definitely do it. Okay, so fast track TND, yes, you can do. I secured a rank. Another one, I'll tell you another story. Sir, good morning. I secured a rank this time of 25,200. Last year rank was 1,28,000. Okay, how do I proceed ahead now? How do I go ahead now? Again, the same thing. Keep on your mind what is your plan, and then you need to go accordingly. Nobody is stopping you, nobody can stop you. It is you who need to push yourself to achieve what you have thought for yourself. Okay, now I'll be taking up your messages from the live chat. Okay, my rank decreased from 88,000 to 1,07,000. I am very much depressed. What should I do now? What is the point in getting depressed? It is a phase of life, it's a part of life. It is not always like that. You are having a Mercedes car and it never breaks down, is it? Isn't it? So, Mercedes can also even have some breakdown sometime, no? So, faults can be anywhere. That's okay. It was just an exam. Take it another time, doesn't really matter. Find your flaws, find your mistakes. Just think of it. Have you given your really 100%? Have you really honestly given it your 100%? Were you disciplined enough to give this exam? If the answer is yes, then we will find some reason that why you are not able to perform so well. Okay, so just again prepare yourself, go ahead with the schedule, make a schedule for yourself, give the INI exam, and then plan for the NEET. If you're planning for NEET only, or give the INI exam. INI will keep you telling you that where you have been, what is your scoring right now, or whatever the score comes there. It will tell you how much prepared you are for the next NEET exam. Okay, that is my recommendation. So not to worry. Depression, getting depressed, it's like a kind of useless thing. You don't have to do that, right? You are already the medicos, guys. You are the cream of the society. You are doing the thing about which so many are actually dreaming of, isn't it? So you are the best of the best people who have been chosen to being a part of this noble profession. So just think of yourself that you are the best of the best people in the community. Okay. Okay, what about the post intern, NEET or next? That's not the point today. Can I take a diploma in ortho if you're not getting MD? So Satyam, it's absolutely up to you. It depends on how your plans of life are. If you want to plan your own setup, if you want to have your own plans of doing some specialty after this, there is no harm in going with diploma also. Okay, so it all depends. But I'll tell you this thing: if you take diploma in orthopedics, then you will not be allowed, or you will not be actually be a part of a medical college. Okay, anywhere around your vicinity, if you plan to join a medical college tomorrow, it will be little difficult for you, because the diplomas are not very much allowed as a part of NMC guidelines, and you will only be a maximum senior resident in the medical college. That's the maximum you can do. Okay, other than DNBs and the MS will be given the preference to go ahead to be a part, to become the assistant professors, associate professors, the head of the department, like that. Okay, so taking the branch, taking the seat is not a bad idea. It all depends on your future perspective about your life, what you have thought for yourself. Okay, that is all about that. Another one, sir, second attempt, general category, rank 11,000. Can I get MS? See, this is the not session right now. We'll be doing a counseling session very, very soon with the seat metrics and all. We do every year. We are going to do this year as well. Okay, how to deal with if parents have done MD medicine and are discouraging me to take MS ortho and told that they won't finance me. See, this is a kind of blackmail if your parents are doing so. Okay, so just tell them that, see, there is a lot of difference between a physician and a surgeon. There is a lot of difference. I always believe. Okay, see, surgeons are always more over on a aggressive side of the thing, always, because physicians all the time, most of the physicians, being a dermatologist, being a general medicine physician, being into other medical specialties like psychiatry, most of the things, I would say, most of the things are on a conservative management. So they always think of a limited patch where everything is conservative. If you think something is going wrong, something is not so good with your patient, you can easily refer him to somebody else. So physicians will always be on a little conservative side. That is a branch of that time. Surgeons have to be always on the aggressive side, because whatever you have to do, you need to decide it on the spot. You need to do it on the spot. Okay, you have to do the surgeries. Now a physician who is managing a case of MI can also say the same thing, that I have to decide everything on the same spot. Agreed. But most of the time, the physician's life has been in the OPDs, most of the time. Okay, surgeon's life most of the time has been in the OTs. So this is little difference. You need to explain to your father that I don't like being a physician, Already I am a physician, being a medico, being a MBBS, I'm already a physician. So if you want me to treat basic OPDs, I can do any point of time in my life. Let me be what I want. Okay. If you are going to do the thing that you actually want, you will always be happy. Okay. Always remember, you are never happy in a marriage which has been done by a force. Either you are marrying somebody by your own choice, or you are marrying somebody with happiness that my parents have selected the girl or boy, like with their own choice. So if you are not happy with the choice for any of the reason, things will not work out for you. Okay, so even if you join the branch, you the MD physician, you will never be happy with your branch, you will always regret. So it is you now, it is your name now, and you need to explain. See, if you are not able to convince your own father, how you will be able to convince your patients in future for the surgery? So be little aggressive, man. Be the surgeon from day one. Go ahead and explain to him, and I'm very sure, and if you want, I can talk to your father on your behalf. Just join what you want. Okay. Okay, so first attempt is in the 2024 strategy for post interns 10-month DBMC regular students. So Vishal, if you are there in the regular batch, you are already getting the instructions. See, everybody who is enrolled with us, I'm very sure that anyone or everyone who are enrolled with us, you are getting the instruction on the regular basis that what all you need to do to stay on the track. Just follow the instructions, and all your course, all your curriculum will be completed properly, along with the surety that all your content is being revised properly. Okay, so just stick to the schedule which we are giving you, and that will be taken care of. What should be the strategy? Those who want to score 35 to 40,000 rank and not chasing a good rank, then I've got no answer for you, my friend. If you're not chasing a good rank, and I've got like no thought that why you are thinking that you only want to get a score of 35 to 40,000. I really have no idea. So I wish you all the very best, that you must achieve what you actually are looking for. But I have really no idea. There is no strategy required for this. Only strategy required for that is go and sit in the exam, and just read the notes one time, remember certain basics, and mark the half paper correct, and you will be there. Okay, that will be like 35 to 40,000 rank. Okay. uh, how to revise 3 days before exam of INI-CT, alpha female. We'll take another session for that. Before the INI strategy, that will be a separate session. 15,000 rank, second attempt, I wanted radio. So I've already answered it, my friend. You can easily go ahead with the plans that you have for yourself, prepare again, or just compromise. Absolutely your call. You want to regret for your life, or you want to like compromise today? Absolutely your call. Or if you want to be a fighter and chase what actually you want, absolutely your call. Okay. How to stop comparing from others' rank and success? The same way, like you maintain your body weight, and you maintain your appetite, and you maintain your sleep. Everybody has their own desires, everybody has their own needs, and same is with you. Everybody is not aiming for radio, everybody is not aiming for ortho, everybody is not aiming for medicine. So you just think you are an individual in the race, and you have to achieve what you are actually looking for yourself. Okay, so you need, comparisons have never led to anywhere. Each passing day, see, everybody should have just one aim. With each passing day, we must have just one goal, that today I am going to be a 1% better person as I was yesterday. So if you can do just one thing different from what you have been doing till now, you will be 1% improvised version of yourself. And mind it, that 1% improvisation in yourself one every day, at the end of 30 days, you are 30% improvised version of yourself. You need to understand this point. Okay, so that is the only thing required, guys, as of now. 1%, a little improvisation per day will lead you to the point where you actually want it to be, right? So stay there and be adamant for what you want. um, so I think my performance is not best because of people surrounding me. So I can just simply say avoid negativity and avoid negative people. Throw them out of your life. Okay. Don't have the negativity in your life, which is not at all required. In life, we have got all our daily routine troubles. Are they not enough to keep us occupied? So why you are keeping negative people around you? Okay. I don't say that everything every time is going to be positive. Ups and downs are part of life. That's all right. But you don't have to think about the negativities of the people, you are troubling you. So just avoid them, just ignore them, and just make your own way. Yeah. Okay, okay. So just stay on the track and avoid these kind of people. Hmm. How should we approach QBank for INI CET beside PYQ? It is difficult to do entire QBank again. So Shweta, I would say that for the INI, entire doing the QBank entirely again, it will be little difficult. So I would say that you should stick to your SWTs, whatever SWT you are giving, and then stick to the PYQ recalls, which we are doing, which we have done already on the YouTube channel of DBMCI, which has been free for all the students. And for all the students who are targeting INI, I must tell you that we have already launched the INI, this TND batch at a very, very nominal price, somewhere close to like 5-6,000 rupees. So you can easily join that. You can keep yourself on track. If you are doing from somewhere else, then absolutely your choice. Don't just try to be on multiple platforms. It's not at all a good idea. So if you want something to keep you on track, just just be a part of that session. So I had not completed some subject like biochemistry OBG before exam. I got a rank of 48,000. I need to do TND, schedule myself to work for upcoming exam with my notes and QBank. So Smriti, that will be absolutely a good idea. See, going in any exam without completion of all the 19 subject has never been actually fruitful for anybody. So you need to understand this point. Every subject is important subject, and all the subjects are compilation of each other for each other. So the integration, when you say integration, orthopedics is not an individual subject. The roots of orthopedics are in anatomy, right? The wings of orthopedics, I must say, are with radiology. So if you want to fly high with orthopedics, obviously you need to have a knowledge of anatomy and obviously part of radiology. Part of it goes to medicine as well. So to learn orthopedics, you must first come across the medicine part, the anatomy part. You must read some part of medicine as well, right? Arthritis of any of the patient, they can be a mutual patient between medicine fellow and the orthopedic fellow. And radiology obviously covers up almost every subject. So it is not at all a good idea to leave a subject before going for the exam. Okay. Uh, my basics were very weak, so should I approach for next? So I told you RSNJ, whatever is your full name, my friend. So I've told you, okay. So just make a schedule for yourself that before this particular date I'm going to cover up this subject, and when I complete my subject, I'll see the class, I'll have my notes ready, I'll have my QBank solved, and I'll go my SWT, I'll do my GT like that. So I'll just see everything, put a a checkpoint on every part, that have I done this or no. So if you're doing everything step by step, it's going to be very, very fruitful for you. That is my assurance to you. Okay. You will try to bring 1% better version of yourself every day. That's fantastic. That would be fantastic. And you will be very, 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 very thankful to, yourself that you tried it and you did it. Okay. Sorry for this bad throat I have today. Okay. Preferring CTVS, okay, DNB 6 years. Absolutely your choice, my friend. Choosing a seat is your choice. Okay, that has to be your love. Like if you love medicine and if you go for surgery, bad idea. But if you think that you want to go for the 6-year course, you can bear the pressure for 6 years. You can get yourself grilled with the patient for that degree. You can wait another 6 years to be a physician or a surgeon. Like after MBBS, you are taking another 6 years to get a degree with your name. That's absolutely okay. Go ahead with it. So that needs little bit of patience. If you want it, you can go for it. I got 2600 rank. It is good to take DNB radio. See, Shahrukh, I would say that Dr. Rajat will be the best person to answer this question. But I would definitely say that if you're getting a DNB seat in one of a good, very good hospital, where you have got all the possibilities of all the USG, CTs, MRI, X-rays and everything else, and a good academics, obviously, not only the machines, then there is no harm in going for a DNB. It is always a good idea to prefer a good DNB radio institute rather than having a peripheral MD radio where you don't have the amenities even. Okay, so that is always a better idea. So I got 63,000 in spite of 2 to 3 revisions. See, always there is a question which always comes again and again, that how many revisions should I do? 2, 3, 4, 5. It is not about the number of revision. It is about the content, how much you have been able to retain after your first revision. Okay, and this you can assess only by giving the test and discussion. Like I told you, we have launched this INI TND. So those who are targeting INI TND, you can easily go for it. Kanal. Okay, Kanal, I have already answered your query, my friend. You can just see the previous part of the video. Which is better, pediatrics or ortho? In which less study required comparatively? See, medical science is something where you have to keep on reading every day. I'm reading till now, okay? And to be honest to you, I have not been able to complete my orthopedics till now. So I'm reading every passing day, I read something new. And nowadays I'm reading something more and more because I know that the upcoming examinations are going to be little more clinical and more like, little bit lengthier. So I need to be more prepared so that I can give the best to my students, number one, and so that I can give my best of the clinical knowledge to my patients as well. So when I do my clinical practice, I don't think the patient should be more dependent first on the investigation part. I first try to assess everything clinically. I'll just examine the patient very, very thoroughly from head to toe, right? Only if the pain is in the leg area, if the pain is coming radiating back from the lower back to the lower limb area, I would prefer to examine the patient as a whole. What is the associated situation? Is the patient anemic? Is the patient having any other like problem? Okay, so I would like to examine the patient. So it is always a good idea to not think like this, that I would like to read less. Being a doctor, if you want to stay on the track, if you want to keep yourself on the track, it is always you will have to read every passing day. There cannot be a day where you are not learning a new lesson. When you pass your when you enter your PG degree, you will be learning something new. When you go into your senior residency, you will be learning something else. When you come into private practice, every day will be teaching you something else. So don't go with what you where you want to study less. But I would say that you should be better prepared in your mind, that if you are ready to do the labor of that PG seat or no. So that is a better thing to think. Should I take a second drop? I got better from the first time, but still around 50,000 rank. I wonder if I could make for through INICT. See, if you are able to get a seat, if you can afford a seat, if you don't mind affording it, go ahead with it. There is no point in wasting another year. But if that is a financial burden for you, that is putting you under a lot of debt, lot of loans have to be taken, you have to sold a piece of land for that, then I think you should give it a second thought and go for a better, like whatever is a better thing for you. You have to decide it and you have to go accordingly, right? Why booklet was very, very useful before going for INI. You should focus on the vibe booklet again. Go through the images of vibes again, because in INI also the questions have been, the images have been repeated from the vibe. So go just revise the vibe. In next primarily 6 subjects will come. No, Bhavya, you are mistaken. In next everything will be coming. Please read the content part of the NMC next one again. Medicine and allied subjects, surgery and allied subjects, OBG, right, with the subjects like that. So pre and post lunch, ENT, ophthalmology. So who said 6 subject will come? Medicine, surgery with anesthesia, surgery comes with orthopedics, medicine comes with dermatology, medicine comes with psychiatry. Okay, and then you have ENT separate, pediatrics separate, ophthalmology separate. So every subject question will be there, right? So don't be in a dilemma, my friends, that in next only 6 subjects will come. All the 19 subjects are important. If you don't read anatomy, orthopedics will not be sorted out, right? Howsoever good I may teach, if you don't study anatomy, it is useless. Okay, so don't be in a dilemma. Please conduct the counseling sessions. Yes, we are going to conduct that very, very soon, not to worry. How to choose between PD and ortho, sir? Interest is equal for both. See, you can't have interest in both the fields, right, at a time. Either you want to be a surgeon or you want to be a physician. Just decide simple thing, whether you want money only, no patients, money only. You want money also and patient also, or you want a lot of patient and you're not worried about lot of money. So choose the field accordingly. If you don't want patients and if you only want money, go for radiology, right? Go for radiology, go for anesthesia. So these branches give you a lot of money, no patient or little patient interaction, right? Very, very little interaction. If you want to have like patients also and money also, go with a physician kind of branch. For example, like limited patients but lot of money. That is what I'm going to say. Limited patient, lot of money. Go with dermatology. Limited patients, lot of money. Okay, dermatology is one branch. Go for ophthalmology, right? Go for ENT, but ENT will have, you will have ophthalmology. ENT will have lot of struggles in the day-to-day life. Okay, if you want to have again money, if you want to put in your own infrastructure, you can go with micro, you can go with path. Okay, like that. You can go with the pharmacology like this. So it depends on what you are aiming for. So decide yourself. You cannot have love for both pediatrics and orthopedics. Okay, so this was like my advice, my friends. So I must tell you at the end of the session now, I have taken broadly all the pictures, all the scenarios of all the groups of students who are available with us right now. So choose wisely what should be your roadmap ahead. If you have been in job, if you have been in not doing well in the first attempt, if this is your now second attempt, so choose wisely the next step. If you want something like other kind of guidance from us, from any of our faculty, do message me. I'll try to get in touch with that faculty and take his time for you for the counseling. But I've taken broadly all the picture. So I would just like to recommend that those who want to give the INI, we have got this INI fast track TND for them as a scheduled batch. You can have your test, you can have your discussion at a particular point of time. And then for those who are going for the next year's exam, we have already launched our regular batch on the DBMCA live app also, and we have already launched the regular batch on our all the face-to-face centers also. So I must remind you here that the regular batch is of two types. One is for the intern batch, one is for the post-intern student where the classes are done whole day. Intern student, final year student can have the intern batch, regular batch, basically the intern regular batch where the classes will be conducted in evening hours. Okay, so regular batch and every other kind of batch, the foundation batches, the pre-foundation batches. So at all our face-to-face centers, we have started doing the demos. We have started giving you the classes. So multiple entry points are there. Make yourself connected with the nearest of your center wherever you are, whichever state you might be. And if you want any further assistance for any other academic thing, definitely I'm always there for you. You can just put a message to me, and I can assure you that all my centers across India, all our partners across India, all our faculties across India, right, all the team of DBMCI is there with you till you get what you are aiming for, right? So as I said earlier, be a little improvised version of yourself with each passing day. Just improvise one thing. Maybe if you're getting late every day, start getting up early, little early. So just little improvement every day in you is going to crack the exam for you. Rest of the things, you have to maintain your discipline. You have to be on the track. You have to follow the schedule. You have to complete the schedule. Be little strict with yourself. If you can follow the strictness, if you can follow the discipline, another 3 months for the INI, another 7 to 8 months for the next exam or the NEET exam that is coming. If you can just stay on track for this time, rest of your life you will have no regrets that I did not tried my level best. So just try your level best, and after that whatever the result comes, see the result people say is not in my hand. Result is very much in your hand. You can manipulate your result, and that can only happen if you just be little disciplined and strict with yourself. Okay, so follow the strategy, follow the discipline for yourself, and I think thank you so much FOMO Medicine for the orthopedic session. Thank you so much for all your love, all your kind words. And I would just end up this session by these simple lines that, guys, we are there for you. We can do everything for you. But the point is, what we cannot do is only to study on your behalf. So you just study, tell us what you want, and we are ready to give that whatever academic content you are looking for, we will be giving you at one place. That is my surety to you. Okay, from DBMCA's end. So we are there to support you till the maximum, but you need to promise us that you are going to get us a rank. Okay, so all the very best to all of you. Thank you so much for being a part of the session. And for any of the ongoing batches, the new upcoming batches at any of the centers of DBMCI or on the DBMCI live app, and you can very well connect with your center partners, or you can put a message to our batch buddy. You can visit our website or call our student customer care number. So they all will be there on their toes to help you out. Okay, so eGurukul, yes, somebody messaged me, is eGurukul complimentary with all the products? Yes, eGurukul is complimentary to all the students of DBMC who are there in the face-to-face batch or in the DBMC Elite batch. eGurukul is complimentary for everyone. Okay, so all the very best everyone. Stay on the track, stay focused, make us proud, and you are surely going to do that. So my bestest wishes to all of you. All the very best.